Alright guys, for my second career profile, decided to do it on recreational specialists in treatment homes. There's an organization in Atlanta, Georgia that actually does this. It's called Shepherd Center. Some of the things about that working environment, they actually were a pretty large environment. It looked like a pretty large workplace. They had 1,500 employees with over 6,600 outpatients seen last year. The hours that you would find there are pretty typical, 9 to 5. I'm sure there's others that would need to stay there a little bit longer, and even some in the night. Some of the typical stressors that people would find, you are working closely with disabled patients or people who struggle with either mental disabilities or physical disabilities. So it would be hard, I would imagine at times, to be able to know how to help them. Sometimes I'm sure you would hit a wall and you'd feel like um, they're not moving in the direction that you want them to, and it'd probably be hard. I would also imagine that with some of those disabilities, there are those who have, speech disabilities or can't communicate. So they're probably just as frustrated not being able to communicate to you the way that they would hope to or want to, and you wouldn't understand what they're saying, I'm sure, and it would be pretty hard. Some of the benefits, at least in this place at the Shepherd Center, they had health insurance, dental, life, disability. They had a flexible spending account. They had paid days off, tuition reimbursement even, retirement plans. They even had homeowners insurance and auto insurance that they offered as well, which I thought was kind of interesting. Some of the tasks that you would have, the main purpose of the job is to evaluate each patient you're assigned and to determine short-term and long-term goals, and then to develop and implement different treatments to help reach those goals. You'll need to record their progress and change up any of those treatments that you had as you see fit. Because obviously the main goal that you have in mind is to help those patients that you're working with move forward and progress in their life and in their ability to do certain tasks. The education requirements that they had, you would have to have a bachelor's degree in this required field. You'd have to be CPR certified, therapeutic recreation specialist certified. You'd also have to have National Council for Therapeutic Recreation certification as well. Sorry, getting hung up on that word. The starting salary is $41,000, and experience would be $62,000. One other thing I thought was interesting is that they said the average growth rate of this occupation is about 7% from now until 2024. So just kind of interesting. Thought it was a pretty cool job. Seemed great to learn about. So thanks, guys. I hope you have a great rest of your day.